Good morning. Just wanted to make a short comment on recent news reports that about 23 patients or residents of nursing homes in Norway have died shortly after receiving their first dose of the COVID-19 vaccine. You may have seen this on the news, the Facebook feeds and Twitter tweets and other social media platforms are also full of these piece of news, and appropriately so. The concern out there is that given that the COVID-19 vaccine has not been studied in the very old and very frail population, which is what these group of people belong to before it was approved, and seeing this number of people dying shortly after receiving their first dose of the vaccine, obviously the big question is, are these deaths related to the vaccine? And if so, what should we do about it? And so I thought we should comment, I should comment shortly on that, since I've posted a number of videos encouraging people to consider getting the vaccine. Again, these videos are for educational purposes. I'm not telling anybody to tell or not to take or not to take the vaccine. This is entirely your decision between you and your primary care provider. So essentially what the news is, as reported by initially by Norwegian health authorities, is that 23 patients or people in very frail health have succumbed shortly after receiving the first dose of the COVID-19 vaccine. It's important to remember that the statement made by the Norwegian health authorities go along the lines, and I'm quoting here, "It may be a coincidence, but we are not sure." And again, there is no certain connection between these deaths and the vaccine, but they did occur, temporarily speaking, shortly after receiving the vaccine. And further, if you read the details of I went on the website of the Norwegian health authorities, and they break it down by age. 7 of these 23 people were over age 90. About 14 were between the ages of 80 and 89, and another 4 were between the ages of 70 and 79, and the rest were younger. And so, as you can tell, the majority of them were old or very old, and they also make the qualified statement that they were in very frail health condition. They were really suffering from a number of severe, sometimes terminal, underlying condition. Lastly, but also importantly, the statement was made that following the autopsies of at least 13 of these people, they have found out that probably the main reason they died were those underlying health conditions that could potentially have been aggravated by some side effects from the vaccine, such as fever, such as nausea, diarrhea, and so forth. So I think it's important to try to put all these facts together and use our brain, as one of my nurses used to say, and make some decisions. In fact, we could go two ways, and you can see this on social media very easily. Some people jump at this data and say, "See, we told you so. There is some dark forces behind all of this, and they're trying to kill the frail and the elderly and the vulnerable, and this is the first proof of that, and there's a lot more to come. Therefore, run away from this vaccine as from the plague, or even worse than the plague that is trying to cure." Or we can try to be objective, look at the data, try to make sense of it, and try to make an informed decision with the facts that we have so far. And this is the latter would be the approach that I'm going to adopt here. So when we have two events that happen close in time, one after the other, like in this case, they got the vaccine and shortly, a number of days after, they died. The fact that two things happen together in time doesn't necessarily that the first one causes the second. For example, if, let's say, I tried to eat avocados for the first time in my life a few days ago, and then 2-3 days later, I develop a severe allergy. Does that mean that the avocado is to blame? Possibly, but not necessarily. Maybe there are other things that account for that allergic reaction. So what I'm trying to say is the fact that two events, two processes happen close in time may or may not indicate that they are causally related to each other. And this is an important thing to keep in mind. There's another recent example that is relevant to our discussion. There's an obstetrician in Florida, I think his name was Gregory Michael, who received in mid-December, I think, his first dose of the COVID-19 vaccine, and 16 days later, he died from a brain hemorrhage. And the autopsy and the testing showed that he developed a condition called autoimmune thrombocytopenia, which causes somebody's platelets to drop to dangerously low levels to the point where even minor trauma or sometimes even spontaneously blood vessels rupture. And in his case, that happened in the brain, had a hemorrhage that unfortunately killed him. Again, the same situation. You have the COVID-19 vaccine done. 16 days later, he develops this condition and dies. Were they causally related or not? That's the key question. So, coming back to our situation in Norway, in order to tease this, to find the answer to this question as to whether the COVID-19 and the death of these people were related, you would need more than their temporal association. You would need to know more about this. Otherwise, the answer cannot be decidedly settled in one way or another. How could we go about that? I'm going to give you some suggestions. It's not an exhaustive list. It's just a mental exercise to hopefully help you understand how to go about this process when we see this news. One way to go about this would be to see what the rate of death in nursing homes before the COVID-19 vaccine was administered was. And in fact, we do have a number that the health authorities in Norway quote. Apparently across the board in recent weeks in Norway, they have seen about 400 cases of COVID-19 dying in nursing homes per week. So relatively speaking, this 23 deaths is a small number. Certainly is not to be neglected, especially if there's a cause and effect relation there. But as they themselves noted, this is not a cause of terrible concern. In fact, they will continue to administer immunizations to this group of people for now until more data becomes available. So if 400 people die in nursing homes in Norway on a regular basis on average, and then the COVID-19 vaccine is instituted, and then following that, week after week, we notice a significantly higher number of people dying from whatever condition that might be related to side effects from COVID-19 vaccine. Then I think we can make a much stronger case that indeed we see an excess mortality after the institution of COVID-19 vaccination, and therefore the possibility of a causal relationship is much, much stronger in that context. It's still not clinched, it's still not 100%. There are other factors that could contribute. For example, the COVID-19 pandemic itself, if it ramps up, if the numbers go up, as we have seen in recent months, mortality goes up too. So we have to be careful in that context too. The next and probably the best thing out there that could settle this question definitively would be a randomized, controlled, double-blind trial in this population of people. Remember, when the vaccine was tested for safety and efficacy, they have looked at tens of thousands of people over 3-phase trials, starting with very healthy people and then including more and more groups of people like we see in real life to see if the vaccine works and if it's safe. However, it's important to remember that these specific group of this group of people, very old, very frail, has not been so far included in such randomized controlled double-blind trials. This type of trial or study is the most accurate in terms of establishing causality. And so if somebody will be able to, and I hope they will, put together such a study to where they compare a group of very old, very frail nursing home residents who receive the vaccine versus a similar group of patients who receive a placebo, something that feels and looks exactly like the vaccine but is just saline or something like that. And then we follow them for a sufficient amount of time, and we see a definitive or a definite increase in mortality in the group of people vaccinated versus in the people who were not vaccinated. Then we will be able to tell for sure there is an issue here and we need to act on it. And if it turns out to be so, and it could very well be, then the decision needs to be made as to whether we stop vaccination in this group or whether we take other measures. And that would be totally appropriate to do so, because if we find out that in the very frail, people who are on the verge of death because of underlying conditions, and if having a fever, having some nausea or diarrhea is sufficient to push them over the edge and kill them, then I think it's very relevant to ask the question, is it worth to vaccinate these people and risk them dying? And perhaps not, again, if indeed this turns out to be a causal relationship. In any case, I hope that what I told you here will help put things in perspective and, more importantly, help you develop a way of thinking around these scary news that sometimes can create a lot of anxiety. I had not a single patient in in the last couple of weeks that is in the senior category that are next to be vaccinated come to me with stories saying, I feel mixed about this vaccine, but my family wants me to get vaccinated because they want me to be able to visit with them, they want me to get my freedom back, and so forth. Should I vaccinate or not? Because I read all these news about people dying left and right from the vaccine. And so I think it's important to develop this skill of judging these news critically, recognizing that the media goes after sensationalism, recognizing that conspiracies are not the same as reality. And my hope is that you will stay healthy, and as I say,